Welcome to Maestro Conference. Please enter the conference PIN number followed by the pound key. This call may be recorded. Thank you. You will now be connected.
Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 25,412 confirmed cases, 708 people in the hospital, and 827 people who have died. Today is one of our state's highest days of reported deaths and hospitalizations since this crisis began. Nationwide, we've passed the grim benchmark with more than 100,000 lost to COVID-19. We continue to pray for the families left behind in the wake of this cruel virus, and we remind ourselves that these aren't just numbers, they're people who've died. In North Carolina, our case count has continued to go up. We know that one reason is because we have increased testing, which is critical to reigniting our economy and keeping people safe. We've increased our testing significantly, and the Department of Health and Human Services COVID-19 website now has an interactive tool to find a testing site in your area. It includes more than 300 places where you can go and get tested. And we have more than 30 private companies and hospitals doing the lab work on the samples to get the COVID-19 results. Today, another private partner, CVS, has announced 55 new drive-through testing locations all across North Carolina. We're glad to have another retail store that offers testing, especially as we work to make testing available to historically underserved communities. COVID-19 is shining a bright light on long-standing inequalities that we have in healthcare. Yesterday, our Department of Health and Human Services launched a radio and video campaign to share important messages about COVID-19 to historically marginalized populations. African American and Hispanic communities make up a disproportionate number of our state's lab-confirmed cases and deaths compared with their percentage in the population. And we must focus on how we can identify these disparities and, most importantly, work to fix them. It's important to keep this gap in mind, both for the location of testing sites and also in contact tracing. Community Cares of North Carolina has now hired almost all of the 250 staff members that we need to get more contact tracing help in our local health departments. Their goal was to complete this hiring by the end of May, and I appreciate their efforts to meet that goal. We know that contact tracing is more effective when that workforce or the contact tracers are diverse and they're representative of the people that they serve. And these new hirings show that. This is critical work that'll help people know whether they've been exposed to the virus and whether to monitor for symptoms or quarantine themselves to protect their loved ones and others. Across the globe, our country and our state, we know that this virus has hurt the economy. Today, I'm pleased to announce that North Carolina has received a federal grant from the U.S. Department of Labor to support job training and temporary employment opportunities. Our Commerce Department's Division of Workforce Solutions requested the funds, and they'll partner with local workforce development boards throughout the state. People are eligible to participate if they've been laid off due to COVID-19. The funds can help pay for on-the-job training, temporary positions focused on COVID-19, or short-term training for workers to learn new skills that are now in demand. This $6 million grant will help our Commerce Department set up these programs, and the state of North Carolina will continue to carry the torch forward as we focus on helping people get back on their feet. As we're now 6 days into Safer at Home Phase 2, please continue to look out for each other. Show respect for those workers who are still trying to navigate this pandemic to keep their customers safe and to keep their businesses open. Be courteous to one another when you're out and about. Remember those 3 W's: wear a face covering, wash your hands, and wait 6 feet apart. Yeah, you've heard these basic safety steps a lot, but they are mighty tools that each of us has to fight this virus. Never underestimate their importance. And let's don't let our guard down. With me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Emergency Management Director, Mike Sprayberry, and Commissioner of Prisons, Todd Ishii. Karen Magoon and Nicole Fox are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now hear first from Dr. Cohen. Dr. Cohen?
Thank you, Governor. We continue to respond to all of the impacts of COVID-19, including making sure our children have the nutritious meals that they need to thrive while schools are closed. We were one of the first states to take advantage of a new federal nutrition program called the Pandemic EBT Program, or PEBT. Families of nearly 900,000 children who receive free and reduced lunch are receiving about $350 in PEBT per child to buy groceries and put food on the table. This program was authorized through the end of the traditional school year calendar, but we know the need for our children won't end at that point. Extending PEBT benefits through the summer would help provide families of nearly half of North Carolina school children about $250 in additional support per child. I've sent a letter to our congressional delegation urging them to support the extension of this important program through our summer months. This pandemic has also created tremendous challenges for the hospitals in our state. They've worked hard to prepare for the influx of COVID-19 patients needing care, but this crisis has also created financial instability at a time where we need our hospitals to be as strong as possible and ready to care for North Carolinians, including the 2 million Medicaid beneficiaries, or more than 2 million Medicaid beneficiaries. To help address these challenges, our department has accelerated the timing of some Medicaid payments that usually would happen in the fall. It's a total of nearly $1.6 billion. And that $1.6 billion has now been distributed to more than 100 hospitals across the state. And while this is a positive development, we know it's only a temporary Band-Aid and that more support is needed for all of our healthcare providers during this crisis. Finally, as the governor mentioned, we're excited about the launch of our new campaign to reach historically marginalized populations, to share important messages about reducing risks for COVID-19. African Americans and Latinx Hispanic communities make up a disproportionate number of North Carolina's COVID-19 lab-confirmed cases and deaths. So our department is partnering with prominent leaders who represent these communities hardest hit by COVID-19. These leaders deliver messages about precautions and testing, contact tracing that will resonate with historically marginalized populations. The campaign includes radio ads and video messages promoting resiliency, coping strategies for our historically marginalized populations, and the 3 W's: wearing a face covering, waiting 6 feet apart, and washing your hands often. Protect yourself and others from COVID-19. I hope everyone likes them and will share these messages widely and use social media and to share them with your friends and family. Thank you, Governor.
Thank you, Dr. Cohen. We'll now hear from our Emergency Management Director, Mike Sprayberry. Mike.
Thank you, everyone, and thank you, Governor, for your leadership. Good afternoon. I'll begin today with an update on severe weather. The remnants of Tropical Storm Bertha passed through North Carolina yesterday. A possible tornado caused minor damage to some homes in Warren County and left behind downed trees, but we're fortunate to report no other significant damages and no injuries. The rains from Bertha, coupled with already high water levels from rain earlier in the week, are causing elevated river levels in many areas of the state. While no major flooding is occurring, people along rivers and streams should remain alert to rising water levels. The state's FEMA website, where you can monitor river and stream gauges across the state and get alerts about flooding in your area, that's fiman.nc.gov. fiman.nc.gov. Go there for information on flooding in your area. Please use caution around rivers and streams with fast-moving floodwaters, and remember not to drive through water moving across a roadway. With tropical storms Arthur and Bertha having already made their way to our state in the month of May, let them serve as a bracing reminder that hurricane season 2020 begins Monday, June the 1st. Please make sure you and your family go to the readync.org website for tips on how to ensure you're prepared. Today is day 80 of the State Emergency Operations Center's COVID-19 response. Teams are distributing personal protective equipment to long-term care facilities in the Triangle area today and tomorrow at a drive-through site in Raleigh. We've had successful distribution events earlier this week in Cullowhee, Fletcher, and Edenton that provided supplies to long-term care facilities in 17 counties. Since we started this operation 2 weeks ago, we've distributed to 60 counties, and this operation will continue next week. Our partners with the Office of Emergency Medical Services, the National Guard, the Civil Air Patrol, and state and local emergency managers have been doing great work planning and operating these distribution events, making sure long-term care facilities have the supplies they need to protect their residents and staff. A special thanks to our volunteers in the Civil Air Patrol. We know we can't successfully respond to emergencies without volunteers. As we continue to obtain and distribute personal protective equipment, our supplies of isolation gowns and N95 masks are improving. We received shipments yesterday of nearly 700,000 N95 masks, and isolation gowns are coming in as well. This is good news, as those are 2 key items of PPE that we need to support increased testing. The FEMA-funded non-congregate sheltering program is continuing to provide rooms for people who need to isolate due to COVID-19. Last week, 44 counties were using the program to shelter nearly 1,200 people. This type of non-congregate sheltering in hotels, dormitories, and other facilities allows for separation and distancing to prevent the spread of the virus. It has been authorized by FEMA for use during this hurricane season, since we won't be able to operate large congregate shelters for evacuees the same way we have in past years. Remember, like the governor and the secretary just told you, observe the 3 W's. Wear a cloth face covering. Wait at least 6 feet apart and wash your hands often. That's wear, wait, and wash. With these simple yet effective tools, we all have the ability as individuals to slow the spread of the virus. That's real power. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Governor.
Thank you, Mike. We'll now take questions from the media. If you can identify yourself and you can identify your station, your organization, we would appreciate it. We'll take the first question.
Our first question will be from Gary Robertson, Associated Press.
Hey, Governor, Gary Robertson with AP. I hope you can hear me today. I've got some technology issues, so if I sound like I'm talking through a soup can, I apologize. Good. The legislature seemed to be very close to sending you a bill that would basically order that bars could open again, provided that they serve outside and also expand capacity for restaurants outdoors. Have you seen this bill, and what are your thoughts on basically the legislature in some ways looking to basically cancel out your order as it relates to bars being closed?
Well, we're 6 days into phase 2, and on a day when we're seeing some of our highest numbers of hospitalizations and death, the Senate wants to open bars. These decisions are difficult, but they are made with daily briefings from doctors and healthcare experts. This legislation would mean that even if there is a surge of COVID-19 that would overwhelm our hospitals, that bars still stay open. Now, I know that it is a tough time for business, and I believe that there will be a time when we can open bars, but that time is not now. And I hope that the House will look at this carefully and that senators will reconsider their choice about this. We got to keep the health and safety of North Carolinians as our #1 priority. Thanks. Next question.
Brian Murphy with McClatchy.
Hi, Governor. Brian Murphy with the News and Observer. I appreciate it. Are you planning to take action against places like Ace Speedway that ignore the phase 2 executive order and open when they're not supposed to or operate with fans? Will you get the Highway Patrol or National Guard involved? And if there are no plans to do anything, what will prevent other events like the RNC from operating without any regard to the rules that are in place?
Well, thanks for that question. Our Department of Health and Human Services has reiterated to local officials in Alamance County that a race with a lot of spectators is dangerous. We are hoping that these things can be handled locally, and we believe that local officials should take action to prevent something like that can cause illness and death. We understand that this particular raceway in Alamance County may not be holding races this weekend, and that's a good sign. And we hope that local officials will take this seriously. I'll say again that across North Carolina, most people and businesses are complying with orders, and not only that, going the extra mile beyond these orders to protect people from the potential of contracting COVID-19. And that's a good thing. And we'll continue to work with local officials and continue to work with businesses to find the best ways to slow the spread. If we have repeated violations that local officials won't take any action on, then we'll have to review all of our options and consider further action that we might take. Thanks for that question. Next question, please.
Vanessa Ruff, WCNC.
Hi there. This is Vanessa Rufus with WCNC Charlotte. Thank you for taking my question. It concerns data, and it's actually a two-part question. First of all, hospitalizations, as you just noted, Governor, hospitalizations hit a new high. In fact, this is the third high that we've seen this week. As far as hospitalizations and the trends we're seeing in the recent days, is there a concern with the direction of this metric as well as the status of hospital resources like beds and ventilators? Second question is percent positives. We've also noticed these trending higher in recent days. I know that you noted that there's been increased testing, which should catch extra cases. So that would account for the growth in the number of cases, but percent positive is supposed to account for increased testing. It's a percentage. So what could be at play here with the growth in percent positive tests that we're seeing in recent days?
Thanks. Well, in answer to your first question, yes, we are concerned about the higher rate of hospitalizations. We do know that our hospitals can surge their beds in order to get ready for a surge of COVID-19. And they did that when in March we issued the emergency order, and they got ready for this. Because North Carolinians responded and did what they needed to do, we were able to flatten the curve, and that overwhelming surge did not come upon our hospitals. What they're doing now is getting back to other kinds of treatments and preventive care and other kinds of surgeries. So there is less room than there was before in the event of a COVID surge. The good thing is that these hospitals have learned how to surge their beds for COVID, and if we see these numbers going higher, they will be ready to surge their number of beds. That being said, we are concerned about the number of hospitalizations for COVID-19 continuing to go up. This is why we're in phase 2 right now and not opening everything up. This is why we think we need to stay in phase 2 for a while to see how these numbers go. Now, our percentage positives are still low. We've seen a little up and down, but for the most part, the percentage positives have remained pretty steady. Sometimes when you do a lot of testing in congregate facilities, so you're going to have a higher number of positives. But I'm going to let Dr. Cohen see if she wants to comment on both of those.
I was going to say the governor did great on I don't have much to add either on the hospitalizations. I think it is concerning and is exactly right why we need to take modest step forwards and to watch these numbers. Are we going to go up and hold in the low 700s, or are we going to continue to increase? So we're going to be watching that number really closely. And I think it reminds us all that the virus is here, it's in our communities, and then our work is to keep the viral spread low, right, and keep that curve flat. And so we don't overwhelm our healthcare system. And again, that goes back to some very simple, tried and true things. It's the 3 W's you hear all the time. And as far as the percent positive, Governor got that exactly right too, which is it's been largely stable. It's been hanging around 8%. Little ups and downs here can be impacted by whatever might have been happening on a given testing day. And again, you can see and follow along with us. Again, each of these data points, whether it's hospitalizations or percent positive, they all have limitations. It's why we need to look at these metrics in combination with each other. We continue to see high numbers of new cases day over day. We're watching that as well. We continue to look at our surveillance data. All of that paints a picture of where we are for North Carolina. And what it tells us is we need to take slow steps and we need to protect each other. So I think that we continue to be on that right path, but we have to take the cautious steps that we are taking. I think I'll go back to where the earlier question, which is why it's concerning to hear about us rushing forward on some additional activities, why we see some of these metrics creeping up. We want to make sure that what we are doing allows us to hold the virus level and that spread steady here in North Carolina so that we can keep moving forward and making progress. Thanks.
Thank you. Next question, please.
Richard Craver, Winston-Salem Journal.
Yes, Governor, this is Richard Craver with the Winston-Salem Journal. I was going to ask you a variation of the question about the bars. I know when the bills were introduced or changed in the Senate, there were two separate bills, one focused on restaurants and then one focused on bars, and they were combined today. And from what I understand from listening to the debate this morning, there were legislators who were leery of combining the two bills. So is there a situation where you might support the bill that was focused on restaurants and the brew pubs, and then not on the one that focuses on the bars?
We're always willing to work with legislators on these kinds of issues. It's important, however, when we're reacting to a virus that we can see significant surge happen in a quick period of time, it's important for our health experts to have the flexibility to take the action that is needed to slow the spread of the virus. And when you have legislation that is passed and fixing a certain situation at a certain time, it's very difficult to go back and undo and unwind legislation. This is why the General Assembly passed the Emergency Act to start with, so that officials can react to these kinds of healthcare crises. This is an unprecedented time. We haven't seen anything like this. We have been successful in flattening the curve, and that's why we felt that it was positive to go into phase 2, but we didn't want to go and open everything back up for concern of numbers going up in a quick way. This is why bars were closed. So, in addition, this legislation prevents local governments from going in and making those decisions. And in all of our orders, we know that there can be hot spots in some of our cities particularly, and wanted local governments to have the flexibility to come in and even do more in their orders in order to protect their people from COVID-19 infections. So I think legislation in this area can hurt the public health, because I don't think, I read this legislation quickly this morning, but I don't even think that it limits it to COVID-19. I think there would be any other kinds of emergencies that health officials could not take steps to do things with bars if they needed to do it for some other reason. So we have concerns about this legislation. We think it has the potential to harm public health. I know that businesses are hurting, and I want to get our economy reignited. And that's why I felt like it was worth the risk to move into phase 2, to open up more businesses in a safe way in order to get the economy moving again. But if you do with this one, what's next? And then are we going to have all of these laws in place that limit the flexibility of healthcare officials who are making on-the-ground decisions, looking at the numbers every day and making decisions about the public health? We don't know what this COVID-19 is going to do. We don't know what's ahead with it. And we hope the General Assembly will leave the flexibility to be guided by the experts on the steps that we take. Thanks. Next question, please.
Kenny Beck, WXII.
Governor Kenny Beck here, WXII 12 News. I have a question for you and for Dr. Cohen. Governor Cooper, earlier in the week, Tuesday afternoon, President Trump said he needed to hear from you within a week regarding the status of the RNC. Is there any scenario where you will be able to tell the president within the next 5 days that the RNC in late August in Charlotte can have full crowds and full participation? And my question for Dr. Cohen is, we are seeing a recent spike in positive cases in Forsyth County, 97 reported by the local health department just since yesterday. That makes up a disproportionate number of cases when you look at Forsyth County's size in the scope of all of North Carolina. What are you aware of as far as the cause there, and how concerned are you about this recent trend? It's not the first time in the last couple of weeks that Forsyth County has seen 50+ plus or more cases in a single day.
Thanks, Kitty. We're ready to hold the RNC convention in North Carolina in a safe way. And for weeks and months, the health experts in our office have had conversations with the people organizing the RNC about how to have it in a safe way. Similarly, we've been having the same kinds of conversations with the Carolina Panthers and with the Charlotte Hornets and other arenas that are going to want to open in a few months. And we're asking for plans from them about how they want to open. When NASCAR wanted to run the race in North Carolina, we asked them for plans about how they're going to run the race in a safe way. NASCAR submitted those plans to our health officials. Health officials gave feedback. They made some changes, and they ended up putting on a very safe and entertaining NASCAR race at the Coca-Cola 600. We hope the same thing can happen with the RNC convention, and we've asked the RNC to submit plans to us. We have yet received any plans. We're not on any timeline here. We want to work with them and look forward to them submitting plans to us. We've yet to see them. I'll let Dr. Cohen answer the other one.
Thank you for the question about Forsyth. Yes, we've definitely been watching. There are certain parts of our state where we're seeing our day over day new case counts go up. We are seeing that in some of our more densely populated areas of the state, Mecklenburg, the Triad, the Triangle. But there are also some of our rural counties also that we're paying particularly close attention to as well. So I think there's a number of things going on. Yes, we are doing more testing, as the governor mentioned in his opening remarks. So that is good. We're doing a lot more testing. We know in the Triad in particular, we knew that was an area of lower testing rate earlier in the pandemic, and we know that we've done a lot more testing there. But it also says we have to be modest and slow in the kinds of activities that we're taking because we are seeing more viral spread. When people move around more, right, we know that the virus is going to have more opportunity to spread, which is exactly why we are trying to take these measured and cautious steps as we open to do it in a way that continues to keep that virus suppression low, right? So what we don't want to see is something ignite and then lots of folks get sick at the same time and overwhelm our healthcare system. So we're watching that very carefully. Again, we work very closely with our hospital systems, track those metrics really closely to make sure that we know what our capacity is in our healthcare system. And so as we look at the Triad, we are looking at those numbers go up, and we want to make sure that we're taking all the precautions that we can. And I'd ask folks in those areas to follow the 3 W's, as well as all those businesses to follow the very detailed guidance that our department has put out. Thank you.
Thank you. Next question.
Jennifer Emmert, WLOS.
Hi, this is Jennifer Emmert with News 13 WLOS. Governor Cooper, can you please explain your decision to make a change in leadership at the Division of Employment Security and any new steps that may be taken to get unemployment benefits to those who need them faster?
I ordered the Department of Commerce to make sure that more people got unemployment benefits faster. And the department is taking a number of steps in order to make sure this gets done. That's just one of those steps that they have taken. I believe that they're going to continue to work hard because these families need the help. We now have over 620,000 people who are receiving unemployment benefits right now, totaling almost $3 billion. But there's still thousands and thousands of people who have yet to receive those benefits. I want to make sure those benefits get into the hands of those people as quickly as possible, not only to help those families hang on, but to help the economy in general. And I believe the Department of Commerce will move toward that goal. Thank you. Next question, please.
Kate Martin, Carolina Public Press.
Good afternoon, Governor Cooper. This is Kate Martin with Carolina Public Press. For journalists around the state, our records requests are languishing for weeks, if not more than a month, at agencies in your administration. Some state officials have promised to cooperate but have done nothing. Others say they don't have to. Public health officials say transparency from the state government is paramount during a pandemic. Several news organizations are now preparing to sue your administration due to this lack of transparency. Governor, do you think it's acceptable for your administration to let records requests get to this point?
Well, number one, we want to make sure that we comply with the public records laws, and I want to make sure that every agency in state government does that. Number two, this administration is making a lot of data available, particularly as it relates to COVID-19, and working hard to make sure that that data is available more and more every single day. Three, these are unprecedented times, and state agencies are stretched to the max in trying to deliver services to state government, sometimes hampered with a lower workforce, with people being home and people being out. So it is difficult. I want to make sure that these agencies respond to records requests. If they say they are not going to get it done, then it better be some reason under the law that they are not going to do it, because I want to see these records provided. And what I'll do is to ask my chief of staff to tell me what's going on, and what particular records that you may be talking about that you want, and see if there's something that we can do about it. Thanks. Next question, please.
Michael Hyland, CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. Also have a question related to what's happening in the legislature today. The House passed a bill earlier that will make it easier for people to vote absentee and by mail without going to an all vote by mail system. When asked if this bill does ultimately make it to you, if you plan on signing this and if you support the various provisions in it. Thank you.
We are, as we've said several times today, in unprecedented times. And there will be a number of people who may feel that it is unsafe for them to physically go out and go to the polls and vote. So any legislation that would make it easier to do no excuse absentee balloting, I think is a positive thing. I'd have to look at all of the legislation. I haven't reviewed the latest version. But I do believe that the legislature and the State Board of Elections should do everything that it can to make sure that people can exercise their constitutional right to vote, and also make sure that there are plenty of places for people to go vote, that there's plenty of time for people to go vote, and to make sure that our elections are secure. We also need to give them the money to do that. I'm hoping, I know legislation is pending to provide funding, and it may be in that particular bill that you're talking about, but they're going to need some more money. For example, poll workers mostly now would be in the at-risk category for COVID-19, and we may have to work harder to find people who can be poll workers at the time of the election. That's just one of the many issues that they're having to consider right now, and we need to make sure that we invest in being able to have a fair election process for everybody in North Carolina, fair, secure, and election process that we can trust. Thanks. Next question, please.
Will Michaels, WUNC.
Hi, Governor. Thanks for taking my question. Will Michaels at WUNC. My question is about utility shutoffs. Your original executive order prohibiting utilities from disconnecting service for non-payment expires on Sunday. The State Utilities Commission has its own order in place, but given that the Commission's order does not apply to utilities like electric co-ops, and given that your order expires in 3 days, can you say whether you intend to extend that order?
First, we know that a lot of families are struggling now. All you have to do is to look at the unemployment figures to show what this global pandemic has done to the economy. People have been laid off of jobs for a lot of reasons related to COVID-19, and we need to try to get help to them. One thing that would be really tough for a family is to have power cut off during this period of time. And we are reviewing now all of our options. We do acknowledge that some of the municipalities and some of the co-ops have more of an issue regarding their financial situation, but we've got to put the consumer first. So we're going to take steps in the next few days to make sure that consumers are protected, and we're working on exactly how we're going to do that. We're well aware that this order is running out soon, and we've been talking to all of the interested parties. We want to make sure that people are protected. Thanks. Next question, please.
Our final question today will be from Travis Fain, WRAL.
Yeah, hi, Travis Fain, WRAL. This question is for the Commissioner of Prisons. Back earlier in May, when a plan was scrapped to do mass testing at prisons for prison employees, the reasons cited were privacy and safety. I was never clear on what privacy and safety issues there were in simply having people, get swabbed in a parking lot. Perhaps you could lay that out in a little bit more detail.
Thank you, Governor. Travis, thank you for your question. Privacy for our staff is very important, and our prison parking lots in many cases are in direct view of the offender population through windows or when they're outside. And just based on my 30 years of experience, I think we owe it to our staff to afford them an opportunity to go through a medical procedure in more of a private setting. Thank you.
Thanks very much for tuning in today, and we'll be back with you again soon. Stay safe, everybody. Thank you.